Hi, everyone, and welcome back to Express, which is becoming everyone's favorite talk show. It is profoundly real and interesting, so without any further delay, please help me welcome back to the stage the beautiful and expressive director of Express, Carolyn. Carolyn, take it away.
Welcome to Express. This is your host, Carolyn. And as we do, our goal is to invite others to share their stories. So, to give hope to others looking on who might be down for whatever reason, frustrated, sad, depressed, give them hope. That's our goal in every episode that we do. And today, our guest is Juliet E. Poyser. However, before I ask her to come in the studio, I'd like to remind you to like, share, and subscribe. For those who have been following us, thank you so much. And for those who maybe just stopped by accident, well, it's not an accident. You're here and you can continue to follow us as we go along. So don't forget to subscribe, like, and share. Now, without further ado, we're going to ask Juliet E. Poyser to come after I read the bio. She is a nurse, more than a nurse. She's currently employed as an assistant professional at NCU and director of nursing. Did you hear that? She is the director of nursing for NCU, which is Northern Caribbean University in the West Indies, Jamaica, the West Indies. She was previously employed as a clinical program manager for wound ostomy care at Mount Sinai Hospital and at New York Presbyterian Medical Center as a wound ostomy nurse. She received her master's in nursing and she specialized in nursing health education from the University of Phoenix in 2010. And she's currently pursuing a doctoral degree at the University of Phoenix. She was instrumental in developing the WOC nurse role at NYP. She served as the New York YWOC nurse organizational secretary and for more than 4 years. She has also done numerous presentations and posters and published many wound and ostomy care articles. She served on two clinical advisory board for two major companies. She's a member of the WOCN Society. In 2011, she won the New York Times Award for Leadership in Nursing. Well, as you know, I never try to cut back on whatever my guest has achieved. But listen, we're going to dig deep and hear more about what she has to say when she started her life up to this point. So we're going to welcome now Miss Juliet E. Poyser.
Thank you.
Welcome to the show,
Thank
Juliet.
you. Thank you very much.
How are you today?
Good, good. It's my pleasure to be here.
Good, good. Thank you so much. Well, I am so honored. And I always say that. And I really do mean that because my guests who I try to invite, they're usually busy people, playing significant role in the community. So I really want to thank you for the time that you've taken out of your schedule to come and talk with me today. And I am sure those who are looking on will be inspired.
Thank you. Thank you.
Okay, so tell me, where were you born? That's the first thing I tend to ask, not all the time, but sometimes. Where were you born?
So I was born in Kingston, Jamaica. And I know when I tell people that, they ask me if that's the only hospital they have in Jamaica because everybody is born in Kingston. But yes, that's where I was born. That's where my parents met.
Lived.
Yes.
Okay. All right. Good, good, good. So, all right. Then you now went on to school. Tell us more about that.
So, yes, I was born in Jamaica, but when I was about 7 years old, I migrated to the United States with my siblings. My parents were already there. And so we migrated to the United States to meet up with our parents who had traveled ahead of us.
Mm-hmm.
I went to Cleveland School in Englewood, New Jersey, and I did all my schooling from first grade all the way through high school in Englewood, New Jersey, graduating from Dwight Moore High School. And then after that, I decided to go to college.
Mm-hmm.
So my college education took place in Jamaica because I figured it would be cost effective and probably easier on my parents if I decided. Plus, at 17 years old, you want to leave home, you want to explore the world and get away. And so I was excited about the idea of going to another country to go to college. So that was part of the reason. And why not go to college in Jamaica? Be able to go to the beach, in between classes. I thought, yes.
Okay. So, child, moving from leaving from Jamaica to United States, new place, new people, meeting new friends. What are some of the challenges you had there?
At 7, I think the only challenge I experienced was that the kids in school would tease me about being Jamaican.
Really?
Yeah, it was, there weren't a lot of Jamaicans in the community where we lived at the time. So I remember being called a skinny, bow legged Jamaican fool, which
Oh no.
oh yeah, and that's what they called. I mean, I had friends and neighbors who were from Barbados and Trinidad, and basically they called us all Jamaicans because they couldn't differentiate, and we were teased a little bit at that time.
Mm,
It's funny because much later, when I got to middle school and high school, it was popular to be Jamaican, and everybody wanted to be Jamaican at that point. But when we first got to that neighborhood, it wasn't as popular to be from Jamaica.
okay.
hmm
So you were excited to be in United States at the time?
I remember when we were flying over New York, how we were fascinated by the lights, and in driving from New York to New Jersey, where my parents resided at the time, we were excited because it was coming up on Christmas, and all the Christmas lights were everywhere. As a
Mm-hmm.
matter of fact, shortly after that, my parents took us on a tour of the neighborhood, and that wasn't something we had seen before. So it was exciting. I can't say that on a more mature level I appreciated it because I was 7 years old.
Mm-hmm.
So for me, the biggest excitement was seeing our parents because we hadn't seen them in a few years. That was the most exciting part of it.
Okay. So go ahead and tell me about high school.
Um, High school was exciting for me. Um, I remember my dad saying, "I heard your names in the newspaper. What did you do?" And the other kids who were nearby said, um, "She's on the honor roll." So I did well in high school. I got good grades. I was very competitive, so I was competing with a lot of my classmates at the time, and so I made sure I studied hard. But it wasn't difficult to do that because my two older sisters did very well in high school, and so I was competing with them as well.
Mm.
So I got good grades. I was voted the second um, shyest person in that class.
Voted.
But yes, they during our senior year, they decided to vote on it because there was a debate between me and another student. Her name was Kimberly, and they said we were the two shyest people in the world, and some people in their world anyway, and they said people were debating if they'd ever heard me speak or if they've ever heard her speak, because we were that quiet in high school.
So, talking about personalities, how would you describe yourself right now?
Well, I think I'm reserved. I wouldn't use the word shy or quiet, but I see myself as reserved. I remember when I was doing a course at Emory University, they did a test, personality test, and in that class, I was voted the shyest person because they did. I forgot the name of the test, but you were to answer the questions, and it would tell whether or not you're an extrovert or an introvert, and so
Mhm.
it was decided based on that test that I was an introvert.
Okay.
Yeah.
All right. So, let's move on to college.
So for college, I wanted to go to West Indies College. I had heard about the college. You know, they had a lot of promotions. I was a member of Grand Concourse Seventh-day Adventist Church, and they did a lot of programs, alumni programs for West Indies College. And so I was always impressed with the people I had met who had graduated from West Indies College. So, I wanted to be one of those. I wanted to be one of those brilliant folks because when we look at that time, at 17, when I looked at the people that I knew that had graduated from college, they were quite accomplished, they were very articulate, and I was very impressed. So definitely wanted to go to college to go to West Indies College for sure.
Mhm.
Yes.
And so you went there. Was get going there? What was? Did you find the qualifications hard to get there to go through to
You
Western
know,
College? What
I think
and what course did you want to
pursue.
pursue?
Well,
Hmm.
I wanted to do medicine at that time,
Hmm.
but ended up doing nursing. Um, it wasn't difficult to get into the program at all because I think the requirements weren't ironed out. So I was able to use my grades, and I was on the honor roll in high school, so it was easy for me to get in. Today, it's a little it's I won't say it's hard, but I would say it's more there's more of a definite outline, and that students have to meet matriculation requirements, and they have to take the CSEC exams. And I think that's for most programs. Certainly for nursing, it is more it's being managed by the Nursing Council of Jamaica, so there's a definitive set of standards that you have to meet to get into nursing. But for most programs, they're going to ask for requirements that you would need for to go to England to
Okay.
go into their program, so it
Mhm.
is a little bit different.
Mhm.
Yes.
You started nursing, and how many years did you do? And did you leave from the college and went to Andrews? Tell me all that about that.
So our nursing program at the time, well,
Mhm.
it's a 4-year program, which at the time was the only 4-year nursing program in Jamaica. It was a bachelor's degree you would graduate with. That was not the case at the other nursing schools in Jamaica. They were associate degree programs. So I was proud to be in a school that would offer me a bachelor's degree when I graduate. The first year was in Mandeville, and then the subsequent 3 years would be spent in Kingston because that's where the facilities, a lot of hospitals are located, uh, um, and which give the students well, all of us an opportunity to do. I would say to get experience with psychiatric nursing, to get experience with acute care, ICU. Kingston would be the place, and not necessarily in Mandeville.
Mhm.
So that's why it was important for us to go to Mandeville at the time. And plus, there was a dorm there, and so there was like a little campus, and we had our classes right there in the dorm. So it was convenient at the time.
Mhm. Did you do practical at Hargreaves?
Yes, thanks for mentioning that.
Yeah.
I-
I
In
wasn't sure because I know they do now, and I
Well,
know she's there.
they don't do now. But
Oh,
when I was a student, yeah, and we need to work on that. But when I was a student, we did our first clinicals in our first year. The students now in the program do not do clinicals in their first year. They usually do general courses and sciences and core courses, religious courses in their first year. So they're not doing any nursing courses until, well, I should say the spring semester. They'll do their first nursing course. But when I was a student, we did do a lot more nursing courses in the first year, and we did our clinicals at Hargreaves. You're right.
okay.
Hmm.
You've graduated. You're now a registered nurse, graduating from IIC at the time, right?
Yes.
IIC, West Indies College, which is now NCU, Northern
Hmm.
Carolina University.
Yes.
You wanted to be a doctor. Did you at any time at that time when you were at RN thought, I should go on to do medicine?
Um, I knew that, that there's a future. There's additional education that can be done, and I knew that I can get my doctorate in nursing, or I can get a doctorate and still be able to have that same kind of impact on patients that physicians do if I so desired, because nurses who are nurse practitioners are practicing on a higher level than the nurses, that works in certain areas in the hospital. So I knew that the way that nursing was going, that even if I wasn't a physician, I could still have that impact by choosing an area of practice where I could be more autonomous.
Yeah.
So nurse practitioners, clinical practitioners, in my role as we'll talk later about
Mm.
being a woundostomy nurse, making decisions, writing, suggesting care, making recommendations for care uh, to the physicians who then put in the orders. So yes, it was, doing nursing. I learned that there are actually other avenues that I could take. So no, I don't regret.
Okay. And you're in the process of doing that. You're a doctorate now, anyway.
Yes, yes.
So we're moving on now to where did you work? Where was your first job?
So, having graduated from Northern West Indies College at the time, um, they had just come out with this idea of students having to do a CGFNS. That was new. I was one of the first students who had to take that exam, which is called Certificate for Graduates of Foreign Nursing Schools.
Mm-hmm.
And then after that, you take the NCLEX. So I had an opportunity to work as a home attendant, which I enjoyed. And I worked as a general nurse, a graduate nurse, until I took the CGF, and took and passed the CGFNS on the first try. Half of it is English. I think it has changed a little bit now, but of course, obviously, you passed the English part, and the nursing part was easy for me to pass. And then I took the NCLEX and passed that. So then I was able to work I worked in New Jersey as a registered nurse, and then I went on to work in New York as a registered nurse.
So
Yeah,
let's just back up a little so that
yeah.
whoever just coming to watch this, you are now migrated back to United States from which where you came initially. United
Yes, yes. I
States,
went home after
Jamaica,
graduation.
Jamaica. You did your nursing. Now you're going back to United States.
Yes.
Yes.
Yeah.
So, what was your first job there? You said.
So when I graduated from West Indies College, went back home, worked as I think I worked as a home attendant.
Hmm. Waiting for the
Um,
results. You said.
well, I just gotten back and I was anxious to work.
Okay.
So when I applied for the CGFNS, I went ahead and got a job before taking the exam, I got a job as a home attendant.
Okay.
Took the exam, passed it, continued to work as a home attendant because I liked it. Actually, then after working as a home attendant, got a job as a nursery school teacher. Loved it.
Yeah.
22 two-year-olds. Um, had to potty train them. They're brilliant little, those little 2-year-olds are brilliant kids. If you can handle 2-year-olds, you can handle any age group. They were like mini psychologists. I enjoyed working there. Obviously, overqualified for the job. The teachers loved having me there. The parents all wanted to meet me because their 2-year-olds came home saying things like, "Mrs. Julie says it's time to put away your toys." So, so they wanted to meet this teacher who had their kids putting their toys away.
Way.
They were blown away, folding up their clothes,
Oh,
putting things away, setting things up. Because soon after I got the job, the teacher that I was working with went on vacation and she did everything. And I was new and confused, and these little 2-year-olds knew what to do and they were directing me. So I allowed them to set up the mats, put away the toys, because she did all of that.
mm.
By the time she came back from vacation, she was blown away
They
because
were all doing it, right?
we were all, yes. So she was like, "Well, I don't have a job. They do everything." Yeah, so
That's
it
how it's
changed.
supposed to be for them to have their independence, right?
Yes,
Yeah.
yes. And when I
Part of
said
the learning.
yes, it was very good. So I really enjoyed that. But then after that, I decided, I need to work in a hospital environment. So after taking the CGFNS and before taking the NCLEX, which is the exam, the nursing exam, I started to work as a graduate nurse in the hospital. And they allowed me to work as a graduate nurse and then work as a nurse after I passed the exam. So I worked at Inglewood Hospital and then decided I wanted to work in a more challenging um, neighborhood. So I left and decided to get a job in New York.
Okay. So which hospital in New York?
So I got the job at Columbia, New York. It has like at least 3 or 4 different names.
Mhm.
And I'm not even sure which one they have now, but it was New York Presbyterian Medical Center
Okay.
or Columbia Presbyterian Hospital. Now, the last I heard, it was the hospitals of Columbia and Cornell.
Mm.
So they have many names, but yes, that is where I ended up working. When I applied for the job, um, I remember being asked. I remember the concern about wanting to get Saturday off.
Mm.
But God is an amazing God because the person who was to hire me was on vacation. And so I was hired by a covering manager, and she was a Filipino, and her parents were Seventh day Adventist.
Mm.
So she hired me. And I probably would not have gotten hired because I was asking for every Friday and Saturday off. But because her parents were Seventh day Adventists, I was hired. And I knew that God intervened because there were other Seventh day Adventists working there who were told they had to work every other Sabbath. And I never worked a Sabbath in all the 25 and a half years that I worked there. God is an amazing God.
Yes. Tell us some more of the experience during those 25 years.
I came out of college saying, I want to take care of male patients. They're going to be more agreeable and easier.
And they are, aren't they? Yes.
Yes. I don't want to upset anybody, but
No,
yes,
no, that's it. The thing I like with them, they're more independent, and there's something about it's just different.
they're just
Just
different.
different. They're different.
Um, so I really and if you work, I worked most Sundays because I got Friday and Saturdays off. And once, and there's always a game on.
Mhm.
And once they're watching their game, you don't have to worry about anything. You go in and you say, "Is everything okay?" And they're like, "Yes, yes, 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 yes,"
Yes,
because they don't want you to don't talk to them. They don't want to be disturbed. They're watching the
yes, the
game.
game. Yes.
So working on Sundays turned out to be a blessing as well because there wasn't a lot going on Sundays. There's not a
Mhm.
lot going on. I got to know my patients, at the beginning of the week. Um, Things were quiet. So and because it was a urology floor, which I loved, urology. Like I said, it's mostly male patients. My work experience wasn't as tough as it could have been working on the floor. So I did urology at first, and then they combined it with ear, nose, and throat. And as one of my colleagues said, who he's no longer with us, but he said it was spit and piss combined. And I hope he's saying it's because it's a urology urine
Mm-hmm.
and it's an ear, nose, and throat. We call it spit. That's how he expressed it.
Just it. Okay.
Yeah, but it was an interesting combination, but it was challenging because the ear, nose, and throat patients often, aside from having sinusitis and other minor things, they also had throat cancer, from smoking, some of them,
Mm-hmm.
uh, so we were dealing with cancers, around the neck and the mandible. So it was challenging, and we had patients of all ages. So it was really tough.
Mm. And after Presbyterian Hospital, where did you go?
So I left. Well, before I go there, I wanted to mention that I did go and study to be a wound ostomy continence nurse. I didn't
And
want.
how, tell us the history of all of that. How did you get into doing that?
So I had a they were we they had one enterostomal nurse. So she taught patients how to deal with their ostomy that they would get as a result of um, having an ileostomy or colostomy or urostomy as a result of surgery. And I was fascinated. I worked on a urology unit. I was working on a urology unit, and I worked on a GI unit. So I was fascinated by it. So I would follow her around all over the hospital. Anytime she had anything interesting, she knew she could get me because I wanted to see everything, and she would show me what she did with wound care as well because I was very interested in that. And when she was ready to retire for the second or third time, well into her 70s, she told administration that I was the only nurse, and there are thousands of nurses in the system, but I was the only nurse that she felt could replace her. And because of that, they asked, they allowed the union and the hospital to come together to pay for my education. I was able to go to Emory University for 9 weeks, and the hospital and the union paid for my education. And when I came back, she was there along with another colleague, which is another story. But she was there to precept me until she finally
Yeah.
retired.
Okay.
Yes, so it was a wonderful experience, and I was able to train when I came back. There was a point when I was alone, so I was able to train skin champions to help me take care of the patient, and also them being trained allowed us to help to reduce the number of pressure ulcers, and we focused on prevention. So we were able to help to have our numbers go down in terms of the rate of pressure ulcers. So it was a good system that we set in place there. That was set in place. So I taught nurses, nursing attendants, nurses, hospitalists. I met with them monthly. So all the new hospitalists that came in every month, I trained them on pressure ulcer prevention and management, as well as do orientation for all the new hires that came into the system. So I was able to do classes. So every month I had at least 3 or 4 classes that I was doing at the university.
And how many patients is in the hospital?
So we had, think, I think we were saying, well, in the facility that I was working with, I believe they had maybe over 750 beds,
Mm.
and they're well over that now because they added a heart center and other beds. So I would say no more, about 800 beds max. And the facility across the street had about 400 beds. That was the Children's Hospital. And the Allen Hospital had about 250 beds. So there was a point in time when, for years, I covered all those areas until somebody was hired to assist me with those areas. Yeah.
Okay, what motivated you to I mean, apart from that lady requesting that you were the only one that she would like to take her place as a ostomy nurse or wound care nurse, what motivated you there? And because I know she saw your interest,
Yes.
that's why she wanted you.
Yes.
So let me just ask you this, because the audience are watching right now, and they know what they don't have a clue what some of the wounds can
Oh,
look like. Because I remember in nursing school, I could put my hand in a wound at some time.
yes.
And what makes you so interested to do that?
Well, so I worked on a GI unit as the assistant head nurse. And I went from that to becoming a wound ostomy nurse. But I was fascinated with wound care. I was fascinated with ostomy care. Um, some people find it, well, repulsive, but I, even especially, if the wound is odorous, but I didn't have a problem with that. And what was exciting about doing both ostomy and wound care is to watch the wounds heal.
You. Hmm.
And I mean, it's not the pay, it's the satisfaction of doing that. And it's not that, a wound nurse is a miracle worker. What you're doing as a wound nurse is you're putting in measures to facilitate the body to do what it wants to do, which is to heal the wound. So you're really setting up an environment of healing. And so it's not because you're a miracle worker, but it's because you're taking measures based on your training to help the body to heal itself. And with the ostomies, you're meeting a patient who's distressed and distraught because they're in the hospital and they're finding out that they have cancer or other diseases, and they have to end up with an ostomy and they don't see the light at the end of the tunnel, and you're in a position to help them to go through this very difficult time in their life and be very supportive and help them through it, so that in the end, and for most patients, like I would say 99% of the patients, you're able to see them get to the point where they accept their ostomy and they learn how to care for it.
For
Very
someone
difficult.
for someone who doesn't know what an ostomy, just in a sentence, just explain.
Oh, so some patients who have, diseases in their bowels, or they have cancer, may end up having a situation where a portion of their bowels removed. And the doctor may either permanently or temporarily bring up that part of the bowel to the skin, and the patient will have to wear a pouch. And the excrement will go into the pouch, and the patient needs to learn how to put on the appliance, and empty it, of course, and manage it. And that's very difficult for some people. But for a lot of the patients, and more and more now, more than in the past, these patients who end up with the ostomies, for a lot of them is temporary, and that's because of the advance in care. But for some of them it's permanent. But it's something that, if they don't have, they may not survive. And so for survival, for some of them, they need to have that ostomy.
Okay.
Yes.
I mentioned, yes, that, and you clarified it too, that we could see wounds where through a bone.
Yes.
Okay.
Yeah.
Is there a way we could prevent that as nurses or any medical profession, or even at home? How can we prevent all of that happening?
So there are pressure injuries, and I mean, we know today something we didn't know before, which is that some of them um, are you can't prevent,
Mhm.
and those are few, and it may be, based on their condition or choice, because some patient may choose not to turn or
Sure.
remove, or yeah. But as healthcare professionals, there's so many things we can do to prevent it, in terms of the surface that the patient is on, and turning the patient because they are too sick to reposition themselves. But just to point out, and I think this is very important for everyone to know or recall, is that even a 10-degree shift in position can relieve enough pressure to prevent an ulcer on the sacrum. So whereas they may be so ill that you can't turn them all the way onto their side, it may be that you can do a 10-degree shift in position by using a pillow, sheets, but just to get them off the sacrum will be able to reduce pressure. And then there are other things, surfaces, um, um,
Bony promising.
yes,
Yes.
pumps, yeah, yeah, the beds,
Menses.
redistribute. We call it pressure redistribution surfaces that also help. Um, and us being able to recognize that a patient needs a surface like that can work, can do wonders to help to prevent pressure ulcer. So there are lots of things that we can do.
And if they're incontinent, to change them frequently.
Incontinence, yes, very
Yeah.
good point, because incontinence, especially fecal incontinence,
Mhm.
even urine, can lead to a breakdown in skin. So where you have an outside in injury with the moisture, and an inside out injury with the pressure. So it's yes, there are lots that we can do to help to prevent it. And even though I'm a wound ostomy nurse and that's what I do for a living, I I'm like, put me out of a job when it comes to pressure injuries. Put me out of the job, prevent them so that we won't have
Of
them
course.
happening to people.
Preventative. Yes, yes, yes. Well, don't laugh because what I'm going to ask you now, please. Where did this butt nurse come from?
Oh, so part of my role, we were having some challenges, and I felt that I needed to help out some of the units in the ICUs with prevention. So when I would arrive, so I would round on the patients, where I would go and ask the nurse to come with me and turn the patient over so we can look at the patient's skin. But when I would come to the unit, sometimes they would scatter. And one of the nurses decided, because most of the pressure ulcers, majority of them are in the sacrum, decided to call me a butt nurse. And so she would announce the butt nurse is here, and the nurses would scatter because, I would make them come with me to look at their patient's skin. Yeah, and
And,
she was proud of it.
because of how vigilant you were to make
Yeah,
sure that things was right, I can imagine. Oh
yes.
boy, I laugh, but it's a serious,
It's
serious.
very
You know,
serious.
it just shows how vigilant you were.
Yes,
Make
yes,
sure they were, their skin was intact. Yes,
yes.
yes. Um, let's see. So go ahead and tell me some more about wound care if you want, if you had anything else to say about that, and then
I worked as a wound ostomy nurse for, I think, about 15, 12 years, certainly 12 years at New York Presbyterian Medical Center. And then I worked in another hospital, Holy Name Hospital, as a wound nurse. And then 4 years, at Mount Sinai Hospital. So it's a role you mentioned, you asked me about why I would consider that area. And I just wanted to point out that the wound ostomy nurses were few and far between.
mm,
And at that time, there were a few thousands, just a couple thousand of us in the United States. There are a lot more now. And so it's grown and grown and grown as people have gotten more interested in that profession. We have more male nurses in that area now, which we appreciate, and so it's an area of expertise that's well respected, and we recognize that there are only a few that, comparatively speaking, that there are only a few people that are ever interested in going into that area of expertise.
okay. Um, so I am going to ask you now. Now that you worked at this hospital, what else did you do in the United States before we go on to Jamaica?
I um I worked at Mount Sinai Hospital. I left Mount Sinai. I worked as a camp nurse, which was very, very interesting. It's a different area of expertise that you need for that. Certainly, have being a wound ostomy nurse helped me because I was familiar with treatments for skin injuries, minor injuries too, that I dealt with at the campsite. Mosquito bites, boils, all these little things. Also dealt with nausea, vomiting. Everything I dealt with at the campsite really reflected on all that I had done at Columbia, because I worked in GI, I worked in oncology. I worked in GYN, which is gynecology. I worked ear, nose, and throat. I mentioned urology. Every area I worked in prepared me to deal with these young children with their concerns. If they had GI issues, I was familiar with what to do. Urology, definitely. So I was able to negotiate. At first, I was like, I don't know if I can do this, but then when I got there, I realized that everything I did in the other facilities and all the areas I worked in prepared me to deal with students' scrapes and bruises and nausea and vomiting and diarrhea and all of that stuff. Yes, so it was really, really good. But so that it was during that period of time that I guess I can mention that I got married and that we came to Jamaica and on vacation. So, and then while on vacation, I remember that I'd always told everyone that I was going to go back to work at NCU and to teach at NCU.
And we're going to stop right there.
Yes.
So, this is part one. Welcome all to come back to listen. Part two. You don't want to miss it. So, until then, I'm going to say bye bye. See you in our next